How about this? Many city nurses will be back on the picket line this morning for day 2 of their strike.
Another story we're following. However, there are some nurses who have already returned to work despite no deal being reached. Let's get right to Good Day's Jessica Formoso. She is live outside Mount Sinai Hospital in East Harlem with more.
Good morning to Shani and Dan. So I don't know if you guys can see because they're far away, but I can tell you a handful of nurses have arrived at this hour. It is now a little bit after 6:30, and it seems like more and more nurses will be showing up within the next hour or so. But again, a handful of nurses here to my left at this hour. This is the largest nurses strike in New York City history. We're talking an estimated 15,000 nurses who walked off the job and onto the picket line yesterday morning. We were here when that happened at that hour at 6 a.m. There were hundreds of nurses out here. Today, unclear how many will be showing up, but again, some of them are out here. Although no deal has been reached, a spokesperson from Mount Sinai telling us some nurses have crossed over the picket line, saying 20% of their nurses actually went back to work yesterday, and they expect more to do the same in the coming days. That said, all the hospitals involved remain open. Their emergency rooms are also open as traveling nurses are helping fill the gaps. The 3 hospital systems affected by the strike: Mount Sinai, Montefiore, and New York Presbyterian. Mount Sinai says it has brought in about 1,400 qualified and specialized nurses, many of whom have already been integrated into the units across its hospitals. Nurses at Mount Sinai tell us the transition was a smooth one, that the traveling nurses were in place and ready to take over once the strike went into effect at 6 a.m. yesterday. The state has stepped in. The Department of Health has staff on site at all affected hospitals, ensuring patient safety and continued care, and the city's emergency management is also working with hospitals to move patients if services are disrupted. Okay, so what led to the strike? Well, the nurses union says they aren't getting a fair contract. Nurses are demanding better pay, safe staffing levels, fully funded health benefits, and improved workplace protections. Hospital management, though, says their demands are extreme. People, of course, concerned for the patients who are now stuck in the middle of these negotiations. We actually spoke to a patient as he was leaving New York Presbyterian yesterday.
Got helped and with no problem at all.
Were you surprised? I mean, were you worried coming in?
No, not really. It went pretty good. You know, I give a lot of solidarity to the nurses.
We all got to be worried. Yeah, this is not polite. This is not right for them.
You want to see the nurses
Back to work.
Last night, the mood was very somber. Many of my patients were afraid. They said, who is going to take care of us when you leave? And I tried to explain to them that the hospital has provided support.
These people that you see here are not here for money. These people are here because we're compromising patient care on a very fundamental level. We're not given the resources that we need, the number of nurses to take care of the number of patients that we need, which is called the staffing ratio.
In a statement, a spokesperson for Mount Sinai said in part, our patients are our top priority, and we are well prepared to continue to deliver excellent care to our communities for however long a strike may last. All of our hospitals and emergency departments will remain open. Montefiore Medical saying all patient appointments remain scheduled unless you hear directly from your provider. And New York Presbyterian saying we have taken the necessary steps so our patients continue to receive the care they trust us to provide. And as we come back here live, you are looking at the small crowd that has gathered here, some of the nurses again on the picket line there. It's just a small crowd, not what we saw yesterday at this hour. When you guys came to us yesterday, there were hundreds of nurses here, but we do expect this crowd to get bigger and bigger throughout the morning. And you guys may remember that the last strike was 3 years ago, and it lasted 3 days. We're now day 2. Unclear how long this strike will last, but of course we will continue to be out here and bring you all the developments as the morning progresses. Dan, Shani?
Jessica, we know you will. Thank you.